Have you ever wondered how a single mutated cell in the breast can silently grow into one of the deadliest cancers in women worldwide? Today, we're diving deep into breast cancer, not just what it is, but how it happens, how it looks, and how nurses can save lives through early recognition and care. Breast cancer is a malignant tumor that develops from the cells of the breast tissue, most commonly from the ductal or lobular cells. It's caused by uncontrolled cell division, where normal breast cells lose control over their growth and start invading nearby tissues and even spreading to distant organs like bones, lungs, and liver. What makes it scary is how it can remain hidden for months, showing subtle changes that are often ignored. But with the right knowledge, we can detect it early, treat it effectively, and change outcomes dramatically. So let's decode this disease step by step. Let's start with what you actually see and feel. The most common sign is a painless lump in the breast, often hard, irregular, and immovable. It's painless because the cancer initially doesn't invade nerves. As it grows, you may notice skin dimpling, giving that orange peel look that happens due to tumor pulling on the ligaments of Cooper beneath the skin. Other signs include nipple retraction, bloody or clear nipple discharge, and changes in breast size or contour. In advanced stages, the skin can ulcerate and lymph nodes in the axilla become enlarged and firm, indicating metastasis. Systemic symptoms like fatigue, weight loss, and bone pain appear later, all signaling that cancer has spread. As nurses and medical professionals, understanding these signs and why they occur helps us not just detect the disease, but empathize deeply with the patient's journey. Now let's go inside the body where it all begins. It starts when genetic mutations occur in oncogenes like HER2, BRCA1, or BRCA2. These genes normally regulate cell growth. But once mutated, they stop obeying control signals. Normal breast epithelial cells begin dividing uncontrollably, forming a tiny cluster known as a carcinoma in situ. Over time, this cluster breaks through the basement membrane, becoming invasive breast cancer. From there, malignant cells enter lymphatic vessels and bloodstreams, spreading to axillary lymph nodes, bones, lungs, liver, and brain. As cancer advances, it steals nutrients from surrounding tissues, leading to tissue destruction, necrosis, and metastasis. This entire process can take years, and that's why early detection through screening like mammography is a game changer. It catches the disease long before it breaks free. Once diagnosed, the fight begins with a combination of surgery, chemotherapy, radiation therapy, and hormonal treatment. Surgery might include lumpectomy, removing only the tumor, or mastectomy, removing the entire breast. If lymph nodes are involved, axillary lymph node dissection is done. Chemotherapy uses powerful drugs like cyclophosphamide or doxorubicin to kill rapidly dividing cells. Radiation therapy targets residual cancer cells after surgery to reduce recurrence. For hormone-sensitive cancers, tamoxifen or letrozole block estrogen receptors, cutting off the tumor's growth fuel. In HER2-positive cases, targeted therapy with trastuzumab Herceptin works like a guided missile against cancer cells. The goal is not just to remove the tumor, but to stop it from ever coming back. And this is where nursing plays a life-saving role. Nurses stand at the front line, from early detection to emotional support. The nursing care begins with preoperative preparation, educating the patient about the surgery and helping her express fears about body image and femininity. Postoperatively, nurses monitor wound healing, drainage output, and signs of infection. Positioning the arm on the affected side is vital to prevent lymphedema swelling due to lymph node removal. Gentle arm exercises help maintain mobility. Emotional and psychological care are equally important, providing reassurance. Counseling and connecting patients with support groups can rebuild self-esteem. Lastly, health education on self-breast examination and follow-up care empowers women to take charge of their health. Because every nurse is not just treating a disease, but helping a woman reclaim her strength, her confidence, and her life.